My name is Bart Warner. I'm 69 years old. I have wet and dry macular degeneration. I had no idea what that was 3 or 4 years ago. One day I was driving home from work and I saw some floaties in my left eye, the dark. Never experienced that before. Told my wife, she panicked. We have a retinal surgeon in my neighborhood, and she made sure I got in to see him the next day, even though he was booked out for several months. He did a thorough examination of both eyes and said the floaties aren't a problem in your left eye, but your right eye has a problem. There's a big red spot back there, and he walked me over to another specialist at one of the top eye centers in the United States here in Salt Lake City. And 5 hours later, I got my first experience with a shot in my eye, which wasn't fun, but I was kind of numb to that because of the shock of what this disease might be. So I started studying about macular degeneration and was devastated to find that there was really no cure. It's a problem that most people get in their 80s or 90s, but here I was at 65 and had a lot to look forward to, and still do, but just hard to describe what's that like to think about being blind. The reality is that Ocuvite and AREDS, I take one in the morning and the other at night, but that is going to help maybe 3%, which they don't tell you on the ads, but it's still worth doing anything. I kept studying and networking around, and I found that there was a friend of mine that had heard about this treatment by a doctor in Riverside, California, that had been treating people with dry and wet macular for 20 years, and that he had patients that were very convinced that this treatment was working. So I got hold of him, made an appointment, got on a plane, and went down there and had my first laser treatment. Had no idea what to really expect, but he stuck this ocular lens on my eye, which is very bizarre the first time it happens to you. But as I talk about this, I'm going to tell you, in my 69 years, I've broken bones in almost every part of my body. A fractured vertebrae in my back, and broken ribs, and bunionectomy, and had my shoulder rebuilt, and nose broken 3 times. So I know pain, and on a scale of 1 to 10, I'll use that. There was basically no pain in the ocular lens. It's just awkward and uncomfortable when you don't understand he's going to put this suction cup on your eyeball. He puts a numbing drop on and some gel. Once you let him get it on there, then he can get through there and see what he needs to do to give you the laser treatment, which is totally painless. It takes about 2 minutes, and the treatment's done. So I thought, wow, everything I could read about it that he gave me, and everything that I could see, his patients were just, his office was packed with patients, and the ones I talked to just were very appreciative in ways I hadn't heard before about the way he talked about a doctor. So I immediately thought, well, I'm busy. I have several different companies I'm still running, and to have to fly down every 90 days for this would be awkward and inconvenient. So I started asking around, thinking about what other ophthalmologist I could get to maybe learn how to do this treatment. So I had a niece who was married to an ophthalmologist that was did an internship at the eye center that I had been going to, and I just called him up and said, "Can I come talk to you?" And I was Matt Ward, and Dr. Matt Ward. And when I came down, I said, "Do you treat or see people that have dry or wet macular degeneration?" He said, "Absolutely." "So what do you do for them?" I said, "It kills me because there's nothing I can really do for them." And said, "What if there's a treatment that would do something for them? Would you be willing to look at it?" And I think initially out of just respect, because I'm his wife's uncle related, he said, yeah, he'd read some things. So I started sending him whatever information Dr. Luttrull could give me, and the information I'd read. He didn't say no. He said, my partner's a little older and he's pretty skeptical about this. And I said, well, what if we bought you a plane ticket to go down and visit Dr. Luttrull and see what he does and how he does this and talk to patients? And as they both read more information, I didn't even know. They bought their own plane ticket and went down and spent a day or two with Dr. Luttrull. The next thing I knew, he wanted a machine, and Dr. Luttrull arranged a time when the machine was up to come make sure it was set up properly. And he called in. He had about a dozen patients set up to come in to do the treatment while Dr. Luttrull was there to make sure everything went well. I was one of those patients. I was the first patient that he did, and I've been getting the treatments from him for the last 3 years. I had shots about every other month or 2 or 3 months for the first year when I was 65. And I was taking laser treatments for 2.5 years. And I don't know how I forgot it, but I missed the treatment. And all of a sudden one day I saw a little bubble in my right eye like I'd seen the first time. And it scared me, so I called triage up at this big eye center and went up there. And while I was waiting to get in to see a doctor, ironically, I got a cell phone call from Dr. Ward letting me know that I'd missed the treatment a few weeks ago. And was I interested in getting more? And I said, absolutely. And I said, this is killing me because here I am with a problem, and if it's because I haven't had the treatment, I'd feel terrible. But he tried to console me, let me know it's probably not that. But anyway, I wouldn't miss a treatment now because the way it feels as a patient to think there's no, especially I'm on the younger side of when people normally get this, but to think there's a way to slow down this disease, especially protecting my left eye. I actually got cataract surgery a year after my first laser treatment. And I have 20/20 vision in my left eye, and it's 20/25 in my right eye. I have definitely had some deterioration in that eye. But my hope is that this will slow down the process and give me even a few more years, weeks, days is worth the treatment. If you haven't ever had a shot in your eye, it's not as bad as what I would anticipate. And again, on a scale of 1 to 10, if a normal shot is a 1 for your COVID shot, or less, I didn't even feel it, but of the dozen shots I had that first year, it was ranged anywhere from a 3 or 4 to the last shot I had was a 9. The doctor just put in a couple numbing drops, didn't wait very long. And I don't know if he hit a nerve or what, but it was the worst pain I've ever had. My knee almost hit my forehead. I would still go through that rather than go blind, but I found another doctor recommended by Dr. Ward, another ophthalmologist, that actually did numbing drops, then numbing gel. He let him wait 5 minutes in between. Then he gave me a little shot, a numbing shot that was about a 2, a 1 or a 2, next to nothing. And so when I got the actual shot, I didn't even feel it. Getting the iodine out of your eye, if they don't get it all out, can be worse than the shot. But there's ophthalmologists that know how to do it better than others, so I would find ones that definitely give you the numbing shot. As far as the treatment that Dr. Ward and Dr. Luttrull does, there's no pain involved. They give you a numbing drop. They put this gel in your eye. They hold the eyelids, and they put this ocular lens on so they can see into the back of the eye. So they know where to give the laser treatment. It takes about 2 minutes. And again, after you've had one or two of these, it's no big deal. I have both eyes treated every 90 days. And I sleep a lot better at night knowing that I have a chance to have this thing help slow down this progression so that if I live another 20 or 30 years, I'll still be able to see. I've got 8 other siblings and 46 nieces and nephews, but one of my aunts on my mother's side had macular degeneration. That was my first introduction to that when she was about 80, and she died just a couple months ago when she was 91. And after I started getting these treatments, I remember being at her house one night about 5 or 6 years ago, and she's as tough a gal as I've ever met, but I asked how she was doing. She says, "Oh, Bart, these shots they're the most painful, miserable things." And she'd break down crying and just say, "I don't know if I can get another shot. I don't know if it's worth it." But we had a great relationship growing up. She put up with me, and I said, "I've got this doctor that has this other treatment that I believe can help you if you're willing to go do it. It's going to be a little uncomfortable." But because of our relationship and trust, she went down to Dr. Ward's office, and I was there the first time she had the treatment. And it was not easy for this 88-year-old to understand what was going on when he put this ocular lens on her eyes. But she went through it, and she believes that it helped her see better. She believes that she finally said, "Let me just go to Dr. Ward and get these laser treatments instead of getting the shots." And her daughter had to convince her the shots were still important. What I've learned from her and Dr. Ward and her daughter, who was willing to talk, because Dr. Ward couldn't with HIPAA laws, but they believe that it made it so she didn't have to have these shots every 30 days. They could stretch them out to 2 or 3 months, which was huge for her. But it's just great having a treatment that can help this terrible disease.